Hello everyone, welcome back to our channel. So today I thought I would put together a video on the top myths about tretinoin. I'd really like to debunk some of them. This is just based on my experience in terms of with patients and also what I see questions-wise on this channel that keep coming up and just in general. So I have put together my top 10 list of the biggest myths about this really powerful prescription skincare ingredient. So before we get started, if you're new to this channel, welcome. If you are a returning visitor, welcome back and thank you for all your support. So let's dive in. We'll start with number one, which is that tretinoin thins your skin. So this is definitely something that people tend to think a lot about tretinoin. They also have this idea about retinol. Well, the truth is no, it doesn't. In fact, tretinoin and retinoids do the exact opposite. They encourage your skin to make more collagen, which then actually is the kind of the scaffold that plumps up the skin, that thickens it. And this is why it's often used to treat texture or to treat anti-aging. So that's why it's an effective skin aging treatment. So that is definitely a myth. I think where it comes from is that actually tretinoin can irritate the skin, and so irritated and dry skin may seem like it's thin, or it may behave like thin skin. So I suspect that's what people are referring to, but yeah, that's a complete myth. If used appropriately and correctly, it doesn't. Number two, next up, is tretinoin causes severe peeling and redness. So this is a myth because if used correctly and appropriately, it should not cause severe peeling and redness. Yes, tretinoin can cause the skin to peel because one of the ways it works is by exfoliating the skin. And yes, it can cause redness if it irritates the skin. And so really this is not the way, this should not happen. You shouldn't get severe redness or severe peeling if you are using it correctly. And by using it correctly, your doctor will put you on a strength that they think your skin can tolerate, so a lower strength usually, and they'll start you at a lower frequency and work you up. If these things are, and they'll also make sure that the rest of your skincare routine works well with tretinoin. There aren't any other exfoliants and things that kind of can exacerbate these effects and irritate the skin. The severe peeling and redness is a myth because that's not what tretinoin should do if it's used correctly. Number three, this I definitely see so much of, is you can't use tretinoin in the summer. And I get behind this is, yes, tretinoin, it can cause your skin to be more sensitive to the sun, just like a lot of exfoliating acids, just like retinol. This is why we tell people you should be on sunscreen anyway and using that, but you need to take extra sun protection to protect your skin against UV damage when you're on something like tretinoin. Now, does that mean you can't use it in the summer? No, absolutely not, because you're supposed to be protecting your skin in the summer. And you're supposed to be protecting your skin against UV damage, even when it's gray, even when you're at home but you're working by a window, because the UV damage, it doesn't have to be a super bright sunny day for the UV rays to get through the clouds, to get through window glass. And you should be protecting your skin all year round. That's both for skin cancer and also from a skin aging and sun damage perspective. So given that you're supposed to be looking after your skin anyway, then there's no reason not to continue tretinoin. And lots of people all around the world in countries where it's sunny all year round use tretinoin. It's just about being sensible and protecting your skin, which, to be honest, you need to do anyway. If you're on tretinoin, presumably you want to improve your skin. Well, what's the point of improving your skin with something, but then you go and damage it with the sun? So yeah, that's a myth. And actually, if you stop it with that purpose and then you go and don't have much sun protection, you're damaging your skin, and then you're also kind of interrupting your treatment with tretinoin. So no, look after your skin, protect it from the sun, and you can use your tretinoin all the time. And if you're not going to do that, I'd question, do you really even, what's the point of being on tretinoin? So next up is number four is tretinoin can only be used for acne. That's absolutely not true. Yes, it's licensed for acne, but Tretinoin has for many years in the right patient been used off license by doctors to treat and healthcare professionals to treat a variety of skin conditions. It can be used to treat hyperpigmentation, scarring, conditions like melasma as part of a treatment either alone or something else, skin aging, obviously, texture, all that sort of thing. And so, so that's definitely a myth. There's a lot more to tretinoin when used correctly and appropriately. Myth number 5, this one is absolutely one of my big bugbears, is that the higher the concentration, the better. And patients do ask me this all the time, and I think a lot of people mistakenly think that, you know, the higher the strength, and I get that, the higher the strength, the more it will do. And that's just not true. Everyone's skin responds differently. And there's a lot of damage that can be done. So tretinoin's already, you know, at least 5 times, in many cases, at least 5 times stronger, 10 times stronger than over-the-counter retinols, depending on the strength. And so really, it's already a high step up if you're using tretinoin and not as a jump up from over-the-counter retinols. Or even if you haven't used anything like that before. And so a higher strength of tretinoin could cause, has a higher risk of side effects. So this includes irritation, this includes sensitivity, it includes peeling, it includes purging, it includes post-inflammatory hyperpigmentation. So if you use too high a strength, it can actually damage the skin. So really, you have to, this is why it's a prescription-only medicine and it's not available to just grab off the counter from somewhere, from your local beauty store, because it is a medication. It needs to be taken seriously, and absolutely not. The best concentration for you is the one that your skin can tolerate regularly, and this is what I tell patients. So it's the one that you can use regularly, because actually with tretinoin, like most topical skin products, or even some systemic ones, nothing works overnight. And so it's about persistence, it's about consistency, it's about regular use over a period of time. And the best thing you can do is get off to a good start by not irritating the skin and having any side effects, because it means you can actually just start using it more regularly and more frequently under the guidance of your doctor. And so, and I always advise people that, you know, even if you're tolerating a low strength really well, if we're seeing great results, there's really no need to jump up to another strength that might actually start to cause problems. So the best strength is the one that you can tolerate without problems, and you can use regularly, and you can see good results with it. And of course, for patients where they're not seeing yet good results, or it's too slow, or it's plateaued, but they're tolerating their current strength, well then, yeah, I'll consider moving them up cautiously, but that's where we are with that. So that's definitely a big strength, and if you take nothing from here, it's that. The best strength is the lowest one that your skin can tolerate, that also gets the job done. Myth number 6, tretinoin works overnight. Absolutely, obviously not. Nothing works overnight, really, even if you're looking at things like lasers, if you are thinking of, you know, if you have acne, and Roaccutane, which is an oral, the strongest kind of oral medication for acne, if you're chemical peels, Botox, you know, whatever it is, nothing works overnight, and certainly tretinoin is no exception. Tretinoin is powerful. It's a topical ingredient. It means you apply it on the skin, and I tell most people, you know, once your skin adjusts to tretinoin, you really shouldn't expect with any topical treatment or to see anything for the first 6 to 8 weeks, because that's how long your skin generally takes to turn over. And most people, when it comes to things like acne, hyperpigmentation, skin aging, whatever, it's going to take longer than that, because it takes time. Tretinoin works in many ways, so it causes the skin to turn over. And it also, you know, if it's being used for skin aging, it relies on stimulating your skin to make more collagen, and so there's the U component in this. So yeah, nothing works overnight. You just have to, use your treatment as prescribed and be patient and be consistent. And people see good results when they follow this very boring but simple bit of advice. The next one, number 7, is definitely something that I would like to dispel. So a lot of people think, if you don't see any peeling, redness, dryness or irritation, then it's not working. Your dose is too low, or your treatment is off, or it's not legit, whatever, it's not working. That is an absolute myth. If you start on tretinoin and you do not experience any side effects, it is because your doctor has done a good job of making sure that you've started in a way that your skin can tolerate it. It means they've gone to a lot of effort to make sure that you are not on a dose that's going to irritate your skin. This is a win. You should be happy. Side effects are things that I personally counsel my patients a lot about because I want everyone to know the worst case scenario. But I'm not trying to provoke the worst case scenario. I'm just telling people what to do. So please remember, if you're seeing these things, this is not something to put up with. It's not par for the course. It's a side effect and one that shouldn't be tolerated. And it means, so I tell my patients, if there's a bit of irritation, whatever, let me know, because we will do something to get through that, to work through it, to stop it. It's not something that you just sit and wait out and grin and bear it. So yeah, if you are not getting side effects, it is not because the treatment's not working. This is a really positive thing, and you should be happy. It means that you're going to be on track because you're going to tolerate your treatment more regularly, and that's going to increase and improve your progress. Myth number 8, tretinoin is dangerous for long-term use. So that's not true. Tretinoin in the right patients can be used indefinitely. It's a safe treatment if it's used in the right patient, if your doctor's checked your medical history, has made sure that your skin can tolerate it, and then no, it doesn't have a limit, and if you're using in the correct amounts. What you can't do is use tretinoin, for example, in situations that we know it shouldn't be used. So for example, if you're pregnant, breastfeeding, or planning to be, then no, you shouldn't be using tretinoin, because vitamin A, retinoids, retinol, all that can have negative effects on the developing embryo. So those are situations. But tretinoin itself, in someone who is appropriate for it and is healthy and has no other contraindications, can be and is often used for a long time, depending on the need. So that's not an issue at all. It's just, again, this is why it's a prescription medicine, because in the right person it can be used for very long periods, if not indefinitely. So myth number 9, you can't use tretinoin with other skincare products. So that's not true. Tretinoin can fit really well in a routine, in a really good basic or even sophisticated skincare routine. There's often no reason that you couldn't be on things like vitamin C, on exfoliating acids, on actives, peptides, or anything. It's just a matter of when. So no, you can't layer tretinoin with your glycolic acid. That's just going to irritate and burn your skin. But that doesn't mean that you wouldn't be able to use for example, a glycolic acid toner 2 or 3 times a week in the mornings on non-tretinoin days, or you stop the tretinoin before you use these things. Tretinoin is very complementary to vitamin C, but would I put them together at the same time? No, because it's going to irritate the skin. So I'm more likely to recommend that someone uses them in the morning. And the other thing, guys, is that with all of skincare, it's a gradual process. So if you start all your actives at the same time, your skin's not going to handle it. So what I recommend with patients is sometimes we might need to stop something for a few weeks and we introduce the tretinoin. So your exfoliating acid, for example. Or if we want to also start vitamin C, we might get your skin to tolerate the tretinoin first, and then we start the vitamin C in the mornings, and gradually, and the dose depends on your skin and how it's responding. So it's just about being a bit thoughtful. It's never all or nothing. It's just, there are very few things you can't use alongside tretinoin. It's just where and how. That's what matters. And then the last one, myth number 10, tretinoin can be used by everyone. Obviously, this is not true. Sadly, people think they see the positives and they think that it's a free-for-all. It's really not. Tretinoin is fantastic. It's one of the most effective topical skincare ingredients that we have, but it is a prescription medicine only for a good reason. if used inappropriately in the wrong people, it can cause burns, it can cause irritation, it can cause allergies, it can cause side effects, all of those things. So in the right person, there's a, you know, and for the right condition, the right goals, it can be great. And even then it needs to be the right protocol. And it can suit a large number of people. It can suit across different age groups, different skin tones. It works in so many, in most people, but it's not for everybody, and that's really important. And everyone's skin is different, so no two people are the same. And even in two people where tretinoin is appropriate, the dose, the strength, the frequency, the type, the formulation may be different, and the effect also may be different. So that's a really important kind of point. Anyway, I'll stop there. I really hope that you found this useful. If you have any other myths that you hear about tretinoin or you're interested in dispelling, please leave a comment below. And if you have any questions about tretinoin or skincare or anything, I'd love to hear from you. So leave a comment below. If you've enjoyed this video, don't forget to give it a thumbs up. And if you haven't done so already, please don't forget to subscribe to this channel and ring the notification bell. Until next time, stay beautiful.